Day. We're on Planetary Health First, Mars Next. I'm Michael, the host and producer, and I am super excited. I have a great friend of mine, Doug Fridsma, who's super smart, super amazing, accomplished, and most importantly, articulate in healthcare about what we need to be talking about to make actionable. And so if you look up his LinkedIn profile or however you do, he knows and breathes health informatics. He's currently the chief medical information or informatics officer at Health Universe. And we'll probably learn a little bit about that from our talk. And he's also the Datavant senior advisor. And he's got a lot of experience in healthcare, IT. I'm trying to go through his bio real quick, like the such as the president, former president, CEO of AMIA, which I'll just say for those. And I think you guys have heard of this organization called HHS, which they change their name every once in a while. I don't know if it was once ONC or whatever, but it's through them as the chief science officer, which is super cool. And then all the other things that you could tell us a little more, but that would be a whole show in itself. Doug, it's so good you're here. If you want to just tell us a little bit about yourself before we dive into today's talk.
Well, thank you, Michael. I'm delighted to be here, and it'll be a fun conversation today. So Doug Fridsma, I was the Chief Science Officer at ONC during Meaningful Use, was sort of responsible for a lot of the technical work that needed to happen to get the adoption of electronic health records in this country. And so spent a lot of time sort of creating a data ecosystem that would allow data to be used and shared across healthcare environments. Now I'm at Health Universe. It's a startup that I've working with Dan Karen. Our goal here is to really try to figure out a way to make the application layer, if you will, within healthcare more accessible, to make it easier for us to use generative AI, ChatGPT, other machine learning models in a safe, effective, transparent, and validated way within healthcare. And so that's what my current work is to try to extend what we started at ONC and really start to try to make this data actionable in ways that are safe and consistent with what we want to do here in healthcare. So glad to be here, Michael.
Awesome. Well, we were in the green room talking a little bit wasn't about Microsoft or Apple, but it was about an operating system, the need for a health operating system. Can you help our audience know more about what that is and what that means and your thoughts?
Well, I was recently at a conference. I was at Vive a couple of months ago, and the health conference as well. And you look around the exhibition hall, and there's all of these organizations and companies and people that have really creative, innovative ideas about how to improve health and healthcare. But you realize that their distribution channels, the way in which they can get their ideas out there, is pretty limited. Most of the access to these clinical environments needs to go through an electronic health record at some point. And I don't believe that the electronic health record is the operating system for our healthcare environments. I think there needs to be things that allow us to create innovative apps, to have them work together, and to use the data that's out there and do it in a way that is safe and that is consistent with what we want to do to protect patients' privacy. And so, a lot of what we've been trying to do with Health Universe is figure out a way to streamline that interaction, make it easier for CIOs and CMIOs and hospitals to be able to deploy interesting ideas and not have to wait for those functions to be part of the electronic health record in a native format. And allow that sort of to accelerate both the access for innovators and the ability for folks that are really trying to use the cutting edge technology have access to that within their healthcare environments.
And so should we get into generative AI? Because I would imagine if you have this operating system, then you would maybe have is a sandbox that you can play more effectively in some of the stuff you're going to make happen, this innovation, or am I on another tangent or on Mars?
No, I mean, as you know, there's been a tremendous amount of talk right now about generative AI and how it's really going to be transformational. And, there's a lot of different perspectives on generative AI and how it works. I mean, at a fundamental level, it's a predictive model that uses probability to determine what's the next word that's most likely to occur as you're sort of answering a question or as you're trying to sort of provide that particular context. But what's really interesting is to take a look at is that the context in which you ask those questions and the data that's used to sort of generate responses really does matter. And while there's a lot of kind of general purpose tools out there, it's really important that we have tools that have specific applicability within healthcare, for example. I think the other thing that's really important is that training these models needs to be done in an environment in which there's transparency, in which we can sort of see what works and what doesn't, and we can share that. I don't think we want to enter with generative AI kind of an era of black box. And we've seen that in some of the tools already, where 1 week it seems to perform in one way and then a tweak is made and now it seems to operate in a different way. And I think we really need to have that sort of transparency about how things are trained and used. There are some initiatives that are going on right now in which people are trying to get together and share data, particularly around sort of training of these models. But a really good model trained on a bunch of, Minnesota Norwegians who live in Rochester, Minnesota, for example, may not always be applicable to someone who lives in inner city Los Angeles. And it isn't to say that those aren't good models, but we just have to be understanding that the kind of prediction about what the next thing might be is going to be very different for someone who lives there than it is for, say, Maria Rodriguez, who's in inner city Los Angeles and has a very, very, very different sort of life experience.
Well, that was helpful. And I think we will definitely be going back to that, but you've heard it live on Planetary Health First, Mars Next, TEFCA. I think I said it right. Tell us all about TEFCA, what it is, why does it matter, and why should we talk about it?
So we're going to hit all the high points about kind of what's going on right now. A lot of people are talking about generative AI and things like that. TEFCA is a little bit more utilitarian, but equally important in terms of what it is trying to accomplish. TEFCA really started back in 21st Century Cures, the legislation that was passed probably 7-8 years ago. I can't really remember. But it stands for the Trusted Exchange Framework and Common Agreement. And it's really an effort to create an information superhighway. And I know that's sort of overloaded term, but it's a way of getting all of these regional networks that are sharing information to use common frameworks and common standards for how they exchange information, and to do so in a way that is safe and effective, and that we have good authentication and authorization as part of that exchange. Right now, they've just got a few use cases, and they just went live last month. There was a couple of announcements that were made out of the Office of the National Coordinator. But I think over time, and particularly in 2024, it's going to be very interesting to watch this, because this is an effort to sort of bring, kind of connect all the dots, to put all of the regional roads and connect them with these highways that will allow them to sort of connect with each other. I think right now we're using older technology. I'm not sure that that's the right approach for us to do in long term, but I know that Mickey Tripathi is working really hard to move us beyond some of the current standards and to get us into a FHIR-based way of exchanging information and make that foundational within TEFCA as well. And so, we've got all this data that's going to be used for treatment, payment, authorization, and clinical care. And I think once we get to the point where there's more of that data flowing back and forth, the hope is that that's going to make it easier for patients to access care. It's going to make it easier for payers and providers and patients to be able to get not just a record from the hospital up the street, but anytime they've been seen at any hospital in the country, to be able to get those records and make those available. And so I think it's going to be exciting to see where this goes, tracking it pretty closely, because I think it's going to have a profound effect on how we retrieve records and how that's all used for things like even things as esoteric as risk adjustment in Medicare Advantage programs. Those are the kinds of things that TEFCA is going to have kind of fundamental changes around.
Wow, I know that's a huge thing because like more than half of Medicare is Medicare Advantage plans. So that's going to be huge. Hopefully that will really drive it. Maybe that will be one of the biggest drivers. So that's great. Let's, like you said earlier, kind of going through the big topics that we're kind of covering. Let's go to another one. It's the founding levels that are still low right now for companies. Where are you seeing, like, tell us what that means and what you're thinking about that?
Well, it's not so much founding levels, it's funding levels.
Yeah, excuse me. I mistyped and misspoke. I get it. So yeah, the funding levels for the founders of startups and companies. So we're talking about funding, excuse me, capital raise, sorry.
I think what we're seeing is a little bit of a pullback among VC and private equity around investments in health IT. I think it worries me in some degree because I think there's a tremendous amount of really innovative and interesting ideas out there. It takes a lot of time, mainly because there are such restricted distribution channels. Everything has to kind of get to the clinical environments, and that's hard. It's hard to create integration. Hospitals move slowly. They tend to be risk adverse. And so a lot of funding levels are pretty low. That makes it a hard environment for folks that are in startups to be able to sort of be productive. But I still think that there are huge opportunities for folks. And I'm hopeful that things are going to level off. Maybe they'll increase a little bit right now. You and I are speaking right now. I'm not at JP Morgan. I think at the end of this week, we're going to have a really much better sense for things as well. But we'll want to track that in 2024. It just means that the bar is going to be higher for startups to be able to get annual recurring revenue and to show some degree of not necessarily profitability, but at least it shows some income that would demonstrate that they're kind of on the right track. It's just so challenging right now, given how fast things are moving. And I think that also, when things are moving really fast, people will tend to sort of step back and kind of wait for things to settle. So we'll see. We'll see what happens, I think, over the course of the next couple of quarters. But I think coming out of JP Morgan, we're going to get a much better sense for kind of where that funding levels are for companies right now.
So how can we accelerate innovation in healthcare?
Okay, so you're going to leave with the big question, right? Try to cover the whole thing. And let me try to pull it all together in terms of some of the things that we've talked about, right? We've got a ton of data that's out there. Oftentimes data is one of the things, certainly it was one of the things that we felt was important at ONC, that data was the fuel that would drive a lot of innovation. And right now we've got a lot of data that's out there. There are the information blocking rules. There are other things like that are really trying to reduce bad habits that people have about sharing information. I think when it comes to data and it comes to sort of that competition and innovation, we need to get to the point of what I call adversarial interoperability, where hospitals and organizations are required to share information because it is for the patient's good, even if it may not be in the financial interest of the organization sharing that information. And I think that becomes really important. Some of the information blocking rules and things like that are sort of moving us in that direction from a regulatory perspective, but that's probably one of the first things. The second, I think, is we really need to kind of increase the distribution channels for innovative products and services. And I think that goes back to this notion of that operating system isn't the electronic health record. It needs to be something that is different, that allows modularity and substitutability with different kinds of apps that are running on the internet and that are running on servers or other things like that in the cloud. We need to have the ability for all of those things to work on a common operating system, if you will, and not have them all have to go through a particular application. I mean, if you can imagine, if Microsoft or Apple, rather than developing an application, rather than developing an operating system in which you could write an application that would run and you could distribute it, if everything had to be all within one environment. We get that to some degree in Android and within the iOS. But if we were to do that across all of healthcare, if that was our model, I think we would really sort of suffer from having a lot of innovation, having to kind of have the bottlenecks in there. And then I think the third thing is that we've got to continue to create funding opportunities for VC and private equity. We need to continue to sort of focus on what the value is. It's a complicated system that we have right now. And I think ultimately the biggest force for innovation is not the 5,000 some hospitals or the 500,000 primary care physicians or the millions of physicians and nurse practitioners and clinical healthcare providers. It's really going to be the patients. So, if we had 320 or 330 million people brought into the healthcare environments and empowered to be first order participants in their care, I think that's what's going to really accelerate healthcare as well. So, we can talk about the esoteric things like how do we exchange data in a common framework that allows us to work? How do we develop an operating system? How do we make sure that good things are funded and they can kind of bubble to the top with things? But ultimately, I think we've got to figure out a way that patients are not the thing upon which the healthcare environment operates, but in fact, they're part of the system. They're actually first order participants in their care. And I think that probably will do more to accelerate innovation than just about anything else. And you see a little bit of that out there, but I think it has not yet, I think, become the primary way in which we interact in the healthcare environments. And I hope that changes. I'm a patient too, and I really do think about my provider and the technology that they have and try to make sure that that's something that allows me to have more agency in the care that I receive.
Yeah, I like that you use the word agency. I think people want to be engaged in their healthcare, and right now it's too siloed. It's problematic from getting an appointment, needing a referral, just the not just the system, but the way that people can. So that to me is what, like you said, I can't say it enough how complicated it is, right? That just from a simple standpoint, I'm not able to get when the doctor sees me because I don't have a certain diagnosis, even though we all know it helped me a lot to work on my diet because I'm not part of that disease club, with obesity or XYZ. He can't even write me an order for a registered dietitian. And how can you exclude that as part of your health to be healthy? So that alone just blows me away,
And the challenge is that we want patients to have agency, but we don't want to burden them with being responsible for all of the decisions and the care and things like that. And I think right now we already do too much of that. Patients have to be, if you become seriously ill, that becomes a full-time job, and it becomes something that is you have to stay on top of all the time to be able to get the things that you want. And, I'm a healthcare provider, and it's even hard for me to sometimes navigate the system. I can't imagine if I was sick or not feeling well and then still having to do that. And so we worry sometimes that health IT is going to add additional burdens to patients. I don't believe that's going to be the case. I think that there's still going to be opportunities to really figure out ways to use that to help patients. But fundamentally, that requires this different way of engaging with patients. It's not about the sickness industry, if you will. It's not about the clinics. It's not about the hospitals. It's not about the electronic health record. It's about having a basic ecosystem in which innovative apps can run and be accessible to patients, to providers, and others. And that it is location independent. It doesn't have to be part of kind of the existing healthcare delivery system. It really should be part of a person's life, if you will, their ability to sort of integrate that into everything that they do. So we could talk all about how there are regulatory and legal and other things that stymie that. But I think ultimately that's still the vision that I hold, is that we have the ability to take healthcare and health IT out of the places in which people are sick and actually bring it to places in which they are well and try to keep them in those places. But it's going to take innovative approaches. It's going to take, technology that's transparent and not, and that's validated and trusted and things like that. And it's going to require getting access to clinical environments and to patients in ways that are not tied to a specific electronic health record or to a specific kind of platform, if you will.
Yeah, I like how you said it, because right now we have virtual care, or telehealth, or or synchronized or async. No, it's just care, whether it's in a wall, and how we do that. And I think you're right that I like how you clearly, it should be clear that health IT could actually help and not harm this. And so what tell me a little bit. I think I'd love to know, I'm sure our audience would love to know more about Health Universe, because it sounds like you guys are doing some really cool stuff to do this, right? You're trying to move the needle forward on this, correct?
Yeah, I mean, what we're trying to do in Health Universe is provide, in some sense, almost like a store, an app store that's independent of a particular vendor or a particular environment or operating system, if you like. The goal here is really to provide an environment in which people can create an app, deploy it safely and securely in a HIPAA compliant container, to have it accessible to patients and providers, regardless of sort of the integration that they might have within their electronic health record. And then to provide a community of people interested in using and developing these apps so that they can evaluate them, to share their experience, to show how they changed, say, an app or its installation or the data that it was used, and improved the use of that. I'm old enough to remember when the American Medical Informatics Association, or AMIA, was actually, they used to have conferences in which the doctors would just set up their computers and the apps that they did, and it was a real kind of hacker environment, if you will, that people were excited and were motivated to try these kind of new things. And although it was a good thing for us to sort of standardize data and to get people on electronic health records and things like that, I think in some sense we lost that innovative spark, if you will. And I think one of the things we want to do within Health Universe is to bring that back, to bring that excitement about using health information technology so that developers can create things that are interesting, get it out there, and have easy access to people that are interested in using new technology. And the same thing is to have the ability for someone who says, I have a real challenging problem in a rare disease community, and I'd love to activate that innovation developer community to help me solve that problem. So Health Universe, in addition to being sort of a marketplace where people can find and use interesting apps that people have developed, from generative AI agents to other kinds of even simple calculators, to have an environment in which people can get access to that, but then also the folks that are trying to develop something that might be useful get access to the problems. They find out what the community needs, what they want, and then collectively can share their experience, can share what works and what doesn't, and do it in a way that's transparent so that people have some sense of trust and assurity that there is, that people are doing the right things, that we don't have a black box, that we're really not sure what's underlying all of that. And I think there's a lot of different environments in which ChatGPT and generative AI are being used, but I think the environments within healthcare are unique. And I think we can lead the way in making sure that there is clear understanding of how things are trained, transparency about how those things are being used. I'm a big fan, and we we have been sort of promoting this as well, is that many of the open source large language models and things like that, I think, are eventually going to outperform. The open source is not so much a business model as a way of creating governance in which people can participate in that governance and understand how the technology is being developed, so that there can't be arbitrary things that happen, that a large language model can be fundamentally changed or pulled out in an open source environment, because there is kind of a collective energy that keeps and sustains it. So, I think Health Universe is really a community where people can gather and talk about those things. It's an opportunity for developers to have access to a larger marketplace. And it's for people who have challenging problems to sort of put that out there and say, listen, here's a problem that I'd like to solve. And then have the community pick that up and figure out ways to sort of solve it. So, at the end of the day, that community then is supported by Health Universe, because we can help integrate that into clinical environments. We can help provide the infrastructure to support the deployment of these things in the cloud, and we can make it easier for folks to communicate and talk with one another, share ideas. So it gets back, I think, to some of those early conferences in which people who were clinicians interested in technology would get together and, talk about the exciting things that they've been able to develop on their app or their Newton or, whatever it was at the time. So those are, I think, the dream that we have. And ultimately, for me, this represents sort of finishing work that was already started. We did a lot of work on developing the data layer and the data within ONC. And now I really want to try to figure out a way to create that innovative application layer where there is lots and lots of new ideas that can be brought to the forefront, bubble up to the top, and be accessible to patients and patient care.
That's awesome. And so if you would say, I guess what I'm gathering is the Health Universe is similar to like the homebrew kits, the hackers that were, just this creativity that is really, creating a community, and that actual open source collective is really accelerating innovation and the applications. So that group that Health Universe is facilitating are there any sort of strategic partnerships that are helping from a clinical point, health groups or health systems that are involved? Or is it more on the technical, more on the developers? Tell us a little more about that ecosystem, the stakeholders.
Well, it's really both. It's a two-sided marketplace, as you can imagine. So from a technology perspective, if somebody has a GitHub repository in which they've developed something in Python or in Streamlit or something like that, we can actually determine all the dependencies. We can deploy it to the cloud and make it accessible to people to be able to execute. And one of the challenges in people that develop a lot of these apps, and they publish the papers and they provide the code and the data, is that the reproducibility is still really hard. It takes a tremendous amount of time to be able to take one of these innovative apps and get it to run on your own machine. Health Universe makes that simple. It makes it a one-click deployment. It loads it up there, and now you've got a web interface that allows you to sort of access it. And so on the developer side of things, it makes it much easier for people who have creative ideas to get them out there and have them accessible to a broader audience. But we're also talking to lots of folks that have unique challenges in the healthcare environments. The rare diseases community, for example, has a lot of really, really important problems that don't get a ton of attention because they're not so profitable, if you will, for someone to develop specific things for that. Well, that becomes a great opportunity to bring those two groups together. Are there things we can help on the rare disease community, and then connect them to application developers that are really interested in making a difference or changing things, right? And so we've got people on sort of both sides of the fence that we're taking a look at. And I think the goal at the end of the day is, can we harness all this innovative work that's happening in generative AI and ChatGPT and other things like that, but do it in a way that's consistent with the values that we have within healthcare, that it's transparent, it's focused on improving patient care, that's trying to solve hard problems that have lots and lots of complexity with it in terms of the kind of medical care and medical care delivery. And so Health Universe is really is trying to kind of cut through all of that complexity and make it easy to deploy apps that people have developed, make it easy to connect with people who have problems or people who have solutions, get those two folks to talk with one another, and then create an environment in which we can sort of have almost the equivalent of nutrition labels on apps, if you will, so that you know where was it trained and who's deployed it, and can I email them and figure out kind of what worked and what didn't. Those are the kinds of things that I think are going to be really important. And, I think there are a lot of folks that are doing that sort of work, but I think it takes people who understand healthcare because they have delivered patient care or they've worked within health IT for a period of time. I think it takes those kinds of folks to come together and help to solve these problems. I don't think you can kind of come in and say, well, this really worked well in agriculture. I wonder if it might work in healthcare. And I think I think we need to have more, I want to say sensitive, but maybe that's not the right word. I think we want things that are more consistent with the values that we have in healthcare to be able to make those advances. That's really what Health Universe is all about, is how can we harness this technology, get people together to solve real problems, and do it in a way that is consistent with the values that we share in healthcare.
Well, Doug, I'm so glad you were able to come on today.
Well, it's been a delight. Michael, we could probably talk for another 2 hours if we wanted to, but I know that people won't listen to a podcast that long.
Unless it's a certain podcast, right? With, I guess anyway, maybe one day, but I don't know.
Maybe one day.
Yeah.
Yes.
But no, this is great. I've really appreciated that you've been able to come on, and just the amount of knowledge you've, shared with what you're doing. That's so important to healthcare. That's why we're here, Planetary Health First, Mars Next, to really move healthcare forward, reimagine healthcare together, if you would.
Well, let me just say, Planetary Health, Mars Next, the Health Universe is actually bigger than that. So, this is why this is a good podcast, because Health Universe is aligned with all of those planetary visions.
I just got it. Good. Well, we hope to see each other this either April or March. We can't tell everyone. It's going to be a small group of meetups. Hopefully we can do that in person and to move healthcare forward. Anyway, this has been good. We're going to wrap it up. And friends, it has been a great journey today on Planetary Health First, Mars Next. Follow us for more on Planetary Health First, Mars Next. Until next time, peace be with you.